Conditions that may require oxygen administration include heart or breathing problems, shock, and several other conditions that may prevent efficient airflow and oxygen flow throughout the body. Conditions that may require oxygen administration include heart or breathing problems, shock, and several other conditions that may prevent efficient airflow and oxygen flow throughout the body. A few signs and symptoms of oxygen deficiency are poor skin color, such as blue, gray, or pale skin, unresponsiveness, cool or clammy skin, difficulty breathing, blood loss, chest pain, and trauma. The first step in oxygen administration is to release a little bit of oxygen to make sure the oxygen cylinder is working properly. After he releases a little bit of oxygen, the second step is to attach the air regulator to the oxygen cylinder with a toothpick insert into the two holes of the oxygen cylinder. Make sure that it is tight and secure. The third step is to attach the oxygen mask to the nozzle on the oxygen mask and make sure it is securely attached. After this is complete, turn the air regulator between 6 to 10 to allow efficient oxygen flow through the oxygen mask. After the air regulator is set correctly, place oxygen mask on patient, making sure the mask is covering the nose and mouth. Slowly turn on the valve to release oxygen to the patient, making sure the patient is taking slow, deep breaths. Caution: make sure it is not too much pressure for the patient because the patient could possibly suffer from a nosebleed. Not enough oxygen: the patient could not efficiently get oxygen through the body and potentially die.
From person's chest. Attach pads firmly to person's chest as shown. Plug-in connector. Analyzing rhythm. Everyone stand clear. Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push the shock button. Shock delivered.
Your caveman can do it.
As long as the adult is moving air through the trachea, encourage the adult to keep coughing to dislodge the object with enough force. If the adult stops moving air on their own, perform the Heimlich maneuver 5 times. Then bend the patient over with support and firmly pat the back in between the shoulder blades. Glove removal is a crucial part in any first responder. Remember, never touch your skin to the contaminated side of the gloves. First of all, carefully pinch the outside of the first glove near the wrist. Secondly, pull the glove towards your fingertips until it is positioned inside out, but make sure all the fingertips stay in the glove. After this is complete, with the still covered fingers of the first glove, grab the second glove near the wrist. After this, pull the second glove completely off, but keep it grasped in the fingers of the first glove. With the uncovered hand, now grab the inside out part of the glove and pull it off. Making sure not to touch any of the contaminated parts of the glove, throw the gloves away in a trash can or bin that's marked for contaminated items. Remember, if you can protect yourself, you're a lot more likely to protect others. For an unconscious, choking, non-breathing adult or infant, you should proceed as follows. Similar to CPR, when a patient stops moving air on their own, the first responder must provide the means to dislodge the object with chest compressions and ventilations. First, use the head-tilt chin lift to clear the airway. After you do this, deliver one breath. If the breath does not go in, repeat the head-tilt chin lift and deliver another breath. If the breath still does not go in, begin chest compressions. For adults and infants, compress the chest 30 times and breathe twice. After the breathing and compression cycle, check the mouth for any obstructions and sweep the mouth to clear the airway. After you get the object out, hopefully your patient will be alive.